My name is Arielle, and I am a nurse in Brown County. I work in a med-surg unit that, due to the novel coronavirus pandemic, has now been deemed our, quote, backup COVID unit. This means that when our primary COVID unit is full, or when it underwent construction to accommodate for the growing need, those COVID positive patients or any patients under investigation would be transferred to us. I know previous nurses have talked about the physical effects of this pandemic, so I want to now speak to the emotional ramifications of the present. There is an enormous sense of fear involved for the patient. They wonder, what does this mean for me and my family? Is there even a treatment for this? Where or when would I have been exposed? Is my illness going to get worse? If so, how bad will it get? Will I have to be on a ventilator? Can I even survive this awful disease? I know these are questions that patients ask because I have heard them all multiple times over the preceding weeks. Not only does this take a toll on the patients themselves, but it takes a toll on the nurses who are faced with such inquiries. Unfortunately, there is just so much unknown in our current state, and I'm sorry, but I honestly don't know, is one of the most difficult things to tell a patient. I know for many nurses, even after we've handed off our patient assignment and clocked out, our brains don't just shut off as soon as we leave work. On our drive home or while lying in bed trying to fall asleep, your mind reflects back on the last 13 to 14 hours. You wonder, could I have done anything better or different for my patients? Did I forget anything pertinent? How will they do over the next 12 hours? Currently, a nurse not only goes home and reflects over these questions, but we now obsess over, was there any time that potentially could have been a breach in PPE or protocol while I was caring for a patient in a COVID room? Could I have committed this breach? Could I have exposed myself to COVID-19? Could I have brought the virus into my home? Can just one accidental breach be enough to infect myself and my loved ones? What can or should I do differently on my next shift? I think we as nurses worry so much about questions such as these because it's not only ourselves that we are trying to protect, but also the families that we come home to, as well as the patients for whom we will be caring on our upcoming shifts. Nurses are trying so hard to make sure that we uphold all of the appropriate precautions in the hospital setting. But unfortunately, this picture is very incomplete if those precautions are only being honored in the hospital. They need to continue beyond the hospital walls. I'm not saying everyone needs to wear PPE, but there are ways to keep our community safe. I completely understand how stressful and awful this social isolating has been. Please believe me that I know. I do, because when I'm not at the hospital, I too am home self-isolating, and it's not easy. It's been physically and mentally draining. But what I do know is exponentially worse right now is being isolated to a hospital room by yourself, or being diagnosed with a potentially life-threatening respiratory illness that can take a life at any age and for which we don't yet have definitive treatment. I can't help but think to myself, at least when I'm self-isolating, I get to be in my own home. For this reason, I feel very strongly about trying to reach out to the young and healthy populations because it is true that these individuals may not be immensely impacted in a physical way by COVID-19 if they were to come into contact. But unfortunately, I have also seen the complete opposite. I have seen patients ventilated who are younger than me, and it is an awful, horrifying experience. I don't want to see more patients test positive, and I don't want to worry so much about my family, my friends, neighbors, myself, and my community. This is why we all need to work together. For me, that means PPE every shift. And for all of us, it means physical distancing and self-isolating. I know it's hard, and I wish it didn't have to be this way. But I've seen what this virus can do, and we need to do everything we can to keep each other safe, sane, and healthy.